speech with us at Cataract Communicators. Her speech topic is universal healthcare reform, and it's an honor and a privilege to introduce Dawn Caccamise back to the podium. Dawn?
Good evening. My name is Dawn Caccamise. How many people can say that they are truly satisfied with the health care plan they have currently today? I am here to tell you, no, I am not satisfied with the health care plan that I have today. I pay way too much for private insurance that limits my doctor visits, my diagnostic testing, and my emergency care. Universal health care reform is needed because of the increased number of uninsured Americans, the increasing costs to individuals and businesses, and also to encourage Americans to take preventative measures when it comes to their health. According to the website www.whitehouse.gov, our leader, President Obama, healthcare reform bill consists of the following: reduce long-term growth of healthcare costs for businesses and government, protect families from bankruptcy or debt because of the healthcare costs, guarantee choices of doctors and healthcare plans, invest in prevention and wellness, improve patient safety and quality health coverage for all Americans, maintain coverage when you change or lose your job, and end barriers to coverage for people who have pre-existing conditions. The first point I would like to make is universal health care reform is needed because of the increased number of uninsured Americans. John Holohan wrote in the Buffalo News on August 16, 2009, that 46.5 million Americans are uninsured, which is increasing by 15,000 people per day. The website www.healthreform.government states that 14% of New York people are uninsured, and that 67% of these families at least have one full-time worker. The major factor which is causing uninsured Americans is due to the high cost of health care. According to C.T. Robertson, about 1.5 million families lose their homes to foreclosure because of the unaffordable medical costs. The second reason that universal health care reform is needed is because of the increased cost to individuals and businesses. The website www.balancepolitics.org states that businesses and individuals pay higher amounts because businesses can only allocate so much funding to insurance. Therefore, less money is spent on raises, new hires, and investments. Individuals will pay more towards their health care reform than their own mortgage payments. The third reason that universal health care reform is needed is because it would encourage Americans to take preventative measures toward their own health care. The website www.balancepolitics.org states that Americans do not visit doctors for minor health problems or preventive medicine. If health problems were detected at an earlier stage, we could avert possibly having major illnesses later on. Routine physicals, mammograms, and HIV testing could prevent complications also. The Center for Disease Control and Prevention for the Health has a Healthiest Nation initiative, which promotes investing money in a network of prevention, health promotion, and preparedness. Free websites such as WebMD and Ask a Nurse offer symptom checklists, diagnoses, causes, and related illnesses that are of no cost to you. In conclusion, universal health care reform is needed because of the increasing number of Americans that are uninsured, the increased cost to individuals and businesses, and it would encourage Americans to take preventative measures when it comes to your health. Based on the questionnaire that I filled out, had everyone here fill out, the majority of people wanted a centralized database for medical records, promote healthy habits in our homes, schools, and workplaces, felt that the government should pay for health care, and half the people felt that the major factor was that all Americans have the eligibility of the same coverage. I urge everyone here today to make a proactive approach when it comes to your health be more informed, take preventative steps toward your health, promote healthy habits. I have a handout in the back with all the websites that I referenced. Thank you for allowing me to speak. Does anybody have any questions? Thank you.
Once again, Dawn blows us away with the statistics. She's very good at those. There's plenty of them there for us. Thank you once again. It was wonderful.
Thank you.
So at this point, what we're going to do then, folks, we're going to bring up Bill Riggi, who is going to give us his evaluation of Dawn's speech from this afternoon. Ladies and gentlemen, Toastmasters, Bill Riggi.
Short and sweet this time, short and sweet. Dawn, like the last speech, I didn't see any flaws. You had the smile, you had the eye contact, you actually stood away from the podium, which I said last time, and you used your hand movement, which was perfect. The speech itself, something very interesting, it's dividing the country right now. It really is. It made probably one of the most famous and liked presidents. I think he was like 77% liked by the American people, down to 60-something. He's slowly declining with his topic on healthcare reform. You had your credibility, which was perfect. You gave a lot of facts and you gave a lot of websites to go to get the speakers interested in going and getting information themselves. The only negative I would have said, but you caught yourself, which was perfect, I would have slowed down giving the websites, but you said you were passing out information with all the websites on there, so that was the only thing I saw wrong with the speech. In your key points, you did change your tone, which also helped you from your last speech. When you talked about something important to you, you actually paused and you raised your voice a little bit. Your perfect grammar in your speech, you defined your key topics perfectly. And just your voice all around is perfect for the audience. So, job well done. Like I said, I didn't see anything wrong, and you would make a great addition to Toastmasters. And it's free until October to join, just to promote that. Plug. I would like to see more speeches, definitely. And then the Toastmaster manual actually has different topics and different speeches that you can bring it into your own, from learning a little bit about yourself to persuading an audience, and both your past speeches have persuaded the audience, so job well done.